Divya, your comments say about 3 minutes past 2 once everyone is settled in.
Yeah, but we'll begin at 2, right?
Yeah, we'll begin at 2. Further proceedings just a couple of minutes after, as people to settle themselves in, I think.
Sorry, people. I'm just concerned. I think that we must have some kind of a contingency plan, because it seems to me that we are going to be from our side, we might have disruptions. I'm sorry that I was out again, so I don't know. What were you talking about, and whether
Anna,
we can plan.
Anna, thank you so much. We lost you. The plan is for you to introduce the session, and of course, as to chair, as you've planned. But should there be any internet disruptions, then we will continue with the program as indicated.
Right. Okay. And then I will just join you when I am back. We can do that?
All right. So Morton's also having difficulty with his Wi-Fi. So Kay, it might be just you and I that will do the introduction and the 15 minutes. Morton, is that fine? If you can just, I know you are having difficulty.
Yeah, definitely fine. Thank you.
Oh, okay.
Sorry, colleagues, we are in a practice session now. In a minute, we will open up. Prof, are you okay with that?
Yeah.
Yes, thank you.
So
Okay.
Anna, you know what? If it's only contingency, then you hand back to us. Otherwise, it's in your hands.
Yes, good.
And then
Thank you.
Morton is not speaking now. Morton has difficulties, so it's just myself and Kay.
Right,
so we
good.
can be allocated about 7 minutes each. Right, thanks.
Right. Thank you, Divya.
Thanks, colleagues. I'll open the session now. In a few seconds afterwards, when I bring down the share screen, that's your cue to start.
It's good to go. Thank you.
Good afternoon, everyone. A very welcome to all of you here to the launch of the new book, Young Masculinities and Sexual Health, Perspectives from Southern Africa. I'm Anna Meyer-Weitz. I'm Emeritus Professor in the discipline of psychology in the School of Applied Human Sciences, and I have the honor to chair the session with you this afternoon. This important publication offers fresh insights into how young masculinities are shaped, challenged, and negotiated in relation to sexual health, gender norms, and the structural realities of
So we have lost Anna, the chair of our session this afternoon. I'm sure Anna will join in as soon as her Wi-Fi connection is feasible. In the meantime, my name is Divya Barner, and I'm delighted to be here this afternoon, and seeing so many of you online makes this entire enterprise so satisfying. I was talking to the co-editor earlier today, in which the question was, how is it possible that we made this book happen? And I want to begin by saying how grateful I am for the collegiality and the support and the absolute brilliance of human connection between and amongst Kay and Morton. And I think it would be remiss on my part not to say, especially for the young scholars here today, how important it is to develop collaborations. Between Morton and Kay, I have known both of them for more than a decade. And it is as a result of these relationships that we were able to put this book together. I'm also so grateful that Andrew Gibbs is here. Andrew, we stand on your shoulders as an expert in the field, and we are so grateful that you are a discussant this afternoon. So what then is this book about, and how did it all begin? If my memory serves me correctly, it was about 222 when, just post-COVID, when Kay and I had a discussion about a book that could address masculinities and sexual health. We were not very sure about what that focus might look like, but initially our thoughts were for a global scope, attending to sexual health and men and masculinities. Now, the idea was also generated immediately after the book that was co-edited with myself, Mary Crew, and Peter Aggleton, called Sex, Sexualities and Sexual Health in Southern Africa. The three of us, including Morton, got together after we determined that a focus on young might be more apt in terms of the work that we do, and more specifically, that a focus on Southern Africa, an area that we all work in, might be most appropriate. We also recognized that there was no composite volume that addressed these issues in a totality. Not to say that this book it's just a beginning of more work to come. And so the idea then was that a focus on young masculinities and sexual health and Southern Africa. And then these are the three terms, the three key terms of the book: young men, sexual health, and Southern Africa. Now, how did we understand young? Initially, the three of us had debates about what constituted the term young. We thought about using the United Nations definition of age, and we struggled to conceptualize what young might mean in terms of the broad literature. Is young a 6-year-old? Is young 26? Or do people, when they're 32, still consider themselves young? And so what we decided to do was to leave that determination to the authors, the magnificent authors who comprise this book, both emerging, new, as well as established scholars. And it is to you whom we are most grateful for coming on board, for doing the hard work, for going through all the drafts and our comments, and ultimately producing this book, which I just received this morning. And I am so delighted as I look at it in terms of what it has been able to do. So we know that issues around masculinities, young men in Southern Africa, often focus on violence, poverty, the context of race, class, and structural inequalities, and the need to address these brittle formations of masculinities if we are to uphold sexual health as well as gender equality. And so this book is located in this crucible where we seek to address how masculinities are being forged. However, beyond simply the scourge of violence and inequalities, we also address major themes such as love, pleasure, and romance. We are interested in the social norms around masculinity and health. But, of course, we cannot deny the issues around sexual risk and HIV, even though HIV seems to be a background issue. And it is against this backcloth that we focus on an analysis of young men, however they are conceived, whether they're 15, 18, or 28, as some of the chapters do. We focus on young men in Botswana, Eswatini, Lesotho, Madagascar, Malawi, Mozambique, Namibia, South Africa, Zambia, and Zimbabwe, in order to show how social, cultural, and gendered expectations shape their experience as they navigate everyday sexual lives. So this book is written almost 3 decades after the Cairo Program of Action in 1994, which called attention to recognizing the need for men's involvement in family life, caring for children, responsible fatherhood, amongst the many issues that confront men, as well as the need to focus on male sexual well-being. In this context, unfortunately, despite just piecemeal evidence, research in journals, and we do not have a volume that looks more comprehensively at what young masculinities and sexual health looks like. And so this book is an attempt to redress that glaring omission as we open up the conversation and build on the shoulders of great giants that have come before us in terms of masculinities in this region and beyond. And we see this book as well as a collaboration not only among scholars, old and new, young and old, in Southern Africa, but also on the continent and more globally. So we are grateful then to the many people, the partnerships, and the project that are reflected in this book. And we are reminded of the interconnectedness of this book with the scholarly community. And to answer Kay's question about how was it possible for us to produce this book, the answer rests in the spirit of human connection, of collaboration, and the vibrant dialogue that has been created and continues to evolve by the scholarly work that makes up this book. We are so grateful to the authors, many of you who are presenting today, or some of you. Whilst our focus is on young masculinities and sexual health, the authorship, as noted, reflects our transnational focus, in which we bring together scholars on the continent with scholars from the north and the south, as we engage in an issue which has local relevance and global significance. We also extend our gratitude to the great academics whose insights and guidance have been invaluable throughout our journey, particularly in the field of critical men and masculinity studies and sexual health, both in South Africa and more globally. And it is upon their shoulders that this book stands, and we are absolutely grateful for the research and the scholarship, and which has been instrumental in the development of this book. Thank you very much, and over to you, Kay.
Thank you, Divya. And colleagues, a warm welcome to this afternoon's and thank you so much for making the time and to share the information with us. Divya has expressed the experiences in the trajectory of putting this book together in very eloquent terms, and I can only emphasize some of the points that she made. We're working alongside colleagues to co-edit the book on masculinities and sexual health. For me personally, it's been an incredibly engaging experience, especially since I've handled the subject in depth over 15 years ago as part of my PhD work, and I've produced some papers. But when you're doing an edit book, it offers you the opportunity to engage the conceptual and epistemological way that other formats are less likely to enable. So I would say that from the onset, when we were keen to undertake a project like this, and it took us a while to agree on a clear and coherent structure for the book. I think as Divya points out, one of the earliest challenges that we faced when deciding the scope of the book was whether should we take a global perspective or to focus more specifically South African context. And obviously there's pros and cons to each method of inquiry. After a number of conversations amongst ourselves and with other colleagues, we agreed to focus on South Africa. And this allowed us to explore kind of nuanced and contextual way the kind of challenges that we face in this region. But an opportunity to dive more deeply into the social, cultural, and health challenges faced by women in the context. Once we to engage our networks to gather support for the book. And here we are truly grateful for the strong enthusiasm and background and the support for the project. I believe, as indicates, that much of the enthusiasm stems from the focus on youth. While there's a growing body of literature on masculinities in general, there's relatively few publications specifically concentrating on masculinities. And I think this is a gap in the big folks. The term young was a very conscious decision early on in the book. As Delia pointed out, we didn't want to focus too rigidly on definitions. Instead, we trusted our chapter editors to interpret young texts. One of the points for me personally to focus on young men is the crucial and formative period of understanding what it means to be a man and how one regulates sexual behaviors and health. So given perspectives on the experiences and identities, that's important for us to be able to transform gender dynamics that influence sexual health outcomes and broader social norms. So by placing young men at the center of the book, we want to guide interventions that promote healthy expressions of masculinity, reduce risk behaviors, and advance gender equality in the region. I think if I had to reflect on one of the greatest challenges in editing a volume like this, is trying to kind of keep the delicate balance required, ensuring overall coherence of the book while simultaneously taking into account and honoring the contributions and individual voices of each of the authors. It's a constant negotiation to diverse perspectives into a collective without diminishing the distinct insights brought through every chapter. So we spend lots of efforts on this, and we truly believe it offers a coherent and insightful read. As with complex projects of this type, coordinating across different time zones and release schedules, this occasionally proved tricky, but we quite soon quickly found a productive rhythm to our activities. So given the diverse array of contributors, we try to prioritize inclusivity by integrating the voices of emerging scholars and local experts. The approach had its benefits in allowing us to reflect on the reality of the region. We aim to capture this richness through dedicated thematic strands in the book, as Deb was pointed out. So ultimately, colleagues, it's our sincere hope that this collaboration has yielded a comprehensive and impactful resource that addresses the critical understandings of masculinity and sexual health in the region. And we are grateful for the authors and contributors to this book. Thank you.
Thanks very much, Kay. For those of us who are struggling to hear you, I'm sure you'll make available some of your notes. There is in the chat difficulty in your line, I think. But thanks very much nonetheless. It's now time to hand over to our discussant, and I am delighted to introduce our discussant, who is such a leader in the field, Andrew Gibbs, who was formerly at UKZN and was now an academic in the Department of Psychology, I think, at the University of Exeter. Andy is a social psychologist, and his research focuses on masculinities, gender inequality, and the intersection of health and economics in South Africa. Andy uses mixed methods and co-production approaches to global health challenges, HIV prevention, and violence against women and girls. Andy, we always look forward to seeing your work, and so it's such a delight that you've accepted the invite to be our discussant, and we look forward now to your input.
Right. Thanks, Davia, for that introduction, and thank you to the editors for inviting me to talk about this book. What I wanted to do for the next kind of 15 minutes or so is to reflect a little about where I see this book sitting in the wider field of men and masculinities, and also thinking about where the book helps extend our knowledge. What kind of additional areas does it contribute to? But first, congratulations, obviously, to the editors, Davia, Morton, and Kay, and the authors for this book. And I think while Southern Africa really has been a key location for the production of knowledge and theory on men and masculinities, particularly in relation to sexual health, and in many ways, I'm thinking back here a bit to the early work on masculinities that we all kind of know and go back to, of Rob Morrell and the various edited collections he and others were involved in, you know, as well as other kind of key scholars. So obviously for me, Cathy Campbell's work, but also kind of even further back to, you know, T. Dunbar Moody's work on masculinities. You know, Southern Africa has been central to the production and theorizing of men and masculinities. But despite this, you know, within the global production of knowledge on this topic on masculinities, Southern Africa remains on the fringes and under-considered when we think about it in the global world. You know, with the majority of research increasingly having been produced in the global north, you know, and this kind of focus has become increasingly evident as I move back to the UK, where the lack of consideration of Southern Africa has been really clear. Now, with the majority of work focused on men's sexual health, has focused on the global north and issues related to those in the north. As such, this edited collection is really important and timely and reasserts the importance of Southern Africa, not only for the kind of space of the production of knowledge and ideas, but also for thinking theoretically about this topic. And I think the area of kind of critical men's studies is strongly theoretical. So it's not just about producing information, but really thinking theoretically about these questions. And it's also been really nice to see that this edited collection has some more seasoned academics, as well as some of the newer academics emerging and working in this field of men and masculinities, both in South Africa, but also across kind of Southern Africa. Again, when we talk about Southern Africa, the majority of work has been focused on South Africa around men and masculinities. So it's been great to see kind of expansion to countries outside South Africa. I guess what I wanted to say was a few things around kind of the importance of young men for South Africa, for Southern Africa, sorry, and frankly, globally, particularly now. You know, the issue of young men and young men's masculinities has become really central to kind of global discourses. And, you know, a lot of this has gone, is seen around the discussion about the hit Netflix show Adolescence, amongst other things. You know, but when we think about where the global kind of dominance of young men is, it's really a huge number in Southern Africa, and young men are a key demographic, but again, rarely considered. You know, it's estimated that Africa has the youngest population globally, with 70% of those in sub-Saharan Africa under 30. And if we think about it in South Africa, a third of South Africans' population is aged 15 to 34. So a huge kind of body of people who we need to think about and consider in sensitive and detailed ways. You know, and as we kind of our focus on young people, particularly young men in the region, is because they're disproportionately at risk of a range of poor health outcomes, not least kind of violence from other men. More widely, when we want to think about young men and the challenges they have around sexual health, we often overlook this, and this is partly because of the HIV epidemic, which has disproportionately affected young women in Southern Africa and continues to do so. But when we look at the specific issues that young men face around access to HIV testing, treatment, and adherence, young men consistently are doing worse on these measures than young women. So if you want to think about the HIV care continuum, where young men are less likely than young women to test for HIV, to start treatment, and to remain on treatment. And we know that a kind of range of structural barriers, stigma, inflexible clinic hours, lack of male-friendly services deter engagement of these young men from the health system. And this all means that as a result, viral suppression, which is obviously a key indicator of effective HIV treatment, is significantly lower among young men. These disparities contribute not only to issues for young men themselves in terms of increased morbidity and mortality, but ongoing transmission to their sexual partners. And the focus on HIV is really important because it helps us start to disentangle some of the structural aspects which we've talked about, but also how young men's masculinities further complicate these issues. Masculine ideals, equating health-seeking behaviour with weakness, which discourage men from accessing services, alongside ideas of kind of men's invulnerability. Suffice to say, the challenges young men face around sexual health in Southern Africa are profound, and this book seeks to centre young men's lives and experiences, and also connect them to the challenges that young women face too. I noticed that a number of chapters in these books really focus in on these issues around HIV, both in understanding the challenges of doing research with young men living with HIV, but also how masculinities intersect with new medical technologies, so both for themselves and for their female partners. So really important pushing the boundaries to engaging with new kind of technologies and new challenges related to sexual health. So I wanted to touch on a few key and important issues that I think this book touches on, which help kind of us think about how it helps move the field forward and moves beyond kind of other work. First, as I think a number of authors point out themselves, the work, and has been touched on already today, the work on young men's masculinities has really been intimately tied to kind of men's violence, sexual risk-taking, and generally deviant behaviour. And a number of chapters directly tackle these issues, as they are critical issues for men themselves and for women. But several chapters seek to provide an alternative reading of young men and to look at questions of love, support. This shifts into questions about the potential of an ethic of care. And this debate about how to think about men and masculinities is not new. It has been one of those which has been ongoing since the field was created in the 60s. But also how much to recognise men's own vulnerability. Gosh, sorry. I think I am back now. We are having internet issues galore. I will continue and hopefully it won't be too bad. Where was I? There we go. Okay, it's talking about this shift towards a greater focus on romantic love and thinking around that. I guess it's really important that this book has done this for a number of reasons. Firstly, it helps humanize young Black men, shifting away from often one-dimensional portrayals of these young men, focused on violence and the problems young men cause. It reflects other similar shifts towards recognizing the challenges young men face, men's poor mental health, and also focusing on emotionality, which complicates simplistic kind of narratives and discourses of men as inherently bad. Secondly, through introducing and reflecting on what we might want to think of as almost countered discourses, it forces all those working on masculinities, including myself, to reconsider how we can think about our work and consider how our focus and research has overlooked these narratives and how they can be weaved into broader questions for understanding sexual health, violence, and HIV. Third, given the wider world and the backlash that we are now seeing against more progressive or liberal forms of gender equality and equity, pointing out that the daily attempts and struggles by those who aren't at kind of the centre to seek to push and challenge towards more equitable world suggests where change can actually happen, not from where power lies in the global system, but on the margins where social and radical change can happen. This has kind of really important implications, I think, for how we want to think about what we do around developing interventions to improve men's sexual health and by extension the sexual health of their partners. For instance, how can these ideas of love and care be woven more clearly into interventions which are typically focused on kind of transforming gender inequitable norms? How can we develop ways of supporting men to build on what they are already doing differently in their daily lives to enhance and extend these, rather than saying they're doing nothing? This requires a fundamental shift in how we think about these topics as well, from a risk model to one where we seek to build on men's strengths, not in some kind of simplistic, poorly specified ways, as I often worry kind of these ideas do, nor in some way, on what has been termed positive masculinities, which seeks to highlight what is good about masculinities, which can inadvertently reinforce men's power, but really focusing on building where young men are already pushing for change themselves and supporting them to continue that, either in their private lives and in their public lives. So second, I think this edited collection helps capture the time in many young people's men's lives when they are stuck between adulthood and childhood, trying to escape the latter, but because of the social, economic and political situations, they cannot do this. They cannot achieve the markers of what is expected of them in terms of kind of masculinity, but rather they feel stuck. This left behindness or stuckness is critical in understanding young men's masculinities and sexual health, as often we see that the challenges young men face and the problems that they cause are not simply because they are young men, but rather because they are stuck in their lives with no clear futures, directions, or hope. And in turn, they develop and construct identities and settings and contexts not of their choosing, which negatively impact on themselves, their loved ones, and their communities. And a number of chapters pick up on this kind of crucial idea. And I think it's really important to think about how this idea of stuckness can be used and leveraged to help think about the problems, but also ways of overcoming problems. I also wanted to think a little about how one of the chapters, that looking at the experiences of young trans men, helps us think about kind of the theory of masculinities. So research on masculinities, particularly in Southern Africa, has tended to narrowly focus on young, heterosexual, Black and poor men. And in many ways, we can understand why. This has been a group which has been important politically for social change, but also because of the impacts of unemployment, violence, and HIV has had on these young people's lives. Hence, we've focused on this group. There's also been some work looking at kind of white men, particularly in the context of colonialism and apartheid and the development of a white colonial class. As such, despite Connell's work on masculinities really embracing gender diversity as she thought about it, far too little work has really pushed beyond these narrow confines and focusing on issues such as trans men and their masculinities and experiences is really important in helping us sharpen how we think about our theorizing about masculinities in general and how we come to understand masculinities, not as an innate property of individuals, but as something that is socially constructed, malleable, and open to change. Fourthly, I just wanted to quickly touch on the important role of social media in young men's lives. The ubiquity of social media in everyday life is clear and needs little to no comment. However, how young men in Southern Africa engage in these issues is increasingly important, both as a huge opportunity, but also raising important questions of the problems it can create. As I mentioned earlier, the majority of work on the ideas of social media and masculinities and sexual health has been in the context of the global north. And while there have been little bits from Southern Africa, it's been less prominent. And as such, this book includes reflection and discussion on the role of social media, which is critical for the field as we move forward. I think finally, the last thing I wanted to raise throughout the edited book, there's the emergence and the idea that masculinities are fluid and in contestation with one another. Too often, masculinities, including young men's, are seen in static terms, fixed and one-dimensional. Chapters in this book seek to capture some of this fluidity and the fight between alternative conceptualizations of what it means to be a young man at this present point, and the complexities of these different positions for different men. In the conclusion of the book, the editors touch on the idea that there are a range of different ways in which masculinities are evolving, with spaces for progressive change highlighted. Some of these changes and struggles are at the individual level and in the context of their private rooms or in relationships. For others, these progressive kind of opportunities are more clearly articulated in the public sphere. Recognition of this fluidity is critical for understanding young men's experiences, how this relates to sexual health, and importantly, that things can change and improve. And that's kind of why we're engaged in this work. In conclusion, this edited book is timeless. It raises issues of importance for young men's masculinities and sexual health in Southern Africa, which remains a crucial topic as we move forwards in seeking to build health-enhancing, more equitable societies at a point in which these ideals are being questioned globally. I look forward now to hearing from some of the authors, and I hope that my internet connection held out for most of the talk. Thank you.
Thanks very much, Andy. That was just fabulous. Your account of the book and its value. So it's now 14:36. We do have a very tight agenda, and as noted, the book is divided into 4 themes, and authors that will present their work are part of these thematic areas. And I'd like to begin with the first theme, looking at love, pleasure, and romance. And we'll begin with Melusi Dlamini. Melusi is an academic, a lecturer in anthropology at Rhodes University, and his PhD research, which features in this book, explores young men's negotiations of love and intimacy and is informed by critical feminist, masculine, and decolonial thinking. Over to you, Melusi, and thank you so much.
Thank you so much, Prof. I'd like to just firstly thank the editors and congratulate the fellow authors in this wonderful and exciting volume, as well as to just importantly extend further thanks to Shanae Singh and Sabrina Maggot for their incredible support throughout this wonderful process. So my paper or my chapter looked at love as resistance, young men's narratives on intimate relationships and healthy sexualities. The chapter explores how heterosexual intimate relationships present as effective spaces for young men to challenge harmful masculinities and the implications this may have for social and sexual well-being for young men. Through this chapter, I challenge the limited understandings of how young men navigate their sexual health in relation to heterosexual intimate relationships. And I then undertake this alternative reading of heterosexual intimacies, particularly as they are located in the township context of Durban, South Africa. Namely, current research reflects that young men's intimate practices are mainly framed as rooted in gender inequitable behaviors, which then tends to position them as the barriers to healthy heterosexual intimacies. While these studies highlight legitimate concerns, they tend to present singular perspectives, which can overlook alternative ways that young men may navigate heterosexual subjectivities and how intimate relationships may generate capacities for improved sexual health outcomes. As a result, there's a limited understanding of the productive value that heterosexual intimate relationships may have for young men's sexual health outcomes in South Africa. And so in this chapter, I conceptualize love and intimacy as transformative and productive forces in young men's lives, which have the potential to surface otherwise overlooked understandings and practices of intimacy. And through this, I contend that within intimate relationships, effective encounters can enable young men to explore alternative pathways and alternative subjectivities. This particular chapter draws on data generated with 34 young men in Durban who all identify themselves or spoke on their heterosexual relationships. And so, in particular, I draw on two localized discourses, which in Zulu are understood as ukuhala, and the other is ukuthandana. So, what is compelling here when we undertake a situated reading of these local discourses, we come to see that while ukuhala, for example, which for participants can show an adherence to heteronormative gender scripts, where young men pursue and are invested in sexual exploits. It also suggests that these masculinities are volatile, that they are not static, because while they are speaking about wanting to enact these hypersexualized masculinities, they also reveal an insecurity in their own experiences. So paying attention to these everyday experiences and the fluidity as they move in between spaces and they express themselves in different ways shows us how even within the risky masculinities, there are these cracks that reveal vulnerabilities that we can draw on to rethink interventions. And then alternatively, with Utandana, what then also surfaced is how young men can become invested in more equal, caring, and intimate performances of masculinities, which then suggest a possible movement towards transforming their daily performances of masculinities. And what I then highlight here is that although these do not suggest a complete eradication of young men's dominance and other harmful practices, they do suggest possibilities and alternative pathways that we can leverage when we are rethinking and when we are designing interventions focusing on young men. So drawing on these local discourses helps us surface departures from the normative everyday practices. Thank you.
Thanks so much, Melusi. And as I hear you, it's just so delightful to see young scholars like you and becoming the inspiration for the other scholars that I see in the webinar chat, our masters and PhD students who are now the future, generation of scholars in masculinity studies. So thanks very much. And now we have Moshibudi Motimele at the University of Free State in South Africa. And Moshibudi is a lecturer, and their work centers on questions of Black intellectual histories, critical pedagogies, and emancipatory epistemologies. Welcome, Moshibudi.
Thank you so much. Am I audible, Divya?
Absolutely.
Okay, thanks so much. So this afternoon, I'm going to be speaking to a chapter that was co-written with colleagues, and I just want to put their names in their room, Malusi Langa, Darian Long, and Katleho Murare. And our chapter is titled Love, Masculinity, and Alternative Pathways to Sexual Health. And I think a lot has been said already in terms of the push towards different types of masculinities and expanding the masculinities that we acknowledge in our communities. So in this chapter, there's really three things we wanted to do. The first was to consider the relationship between sexual health and young Black masculinities. In terms of sexual health, we really wanted to focus on not only risk-taking behavior, but sexual health as understood as comprising both physical and mental well-being. And we really wanted to center issues of pleasure and love and vulnerability, which sometimes get sidelined in conversations about sexual health for obvious reasons, considering the levels of danger and risk that other issues take. And so just to speak about the pool or the methodology in terms of the chapter, the interviews that were done in Alexandra and Vosloorus, which are in Joburg. For people who don't know, Vosloorus is in the east, and Alex is in Sandton. And the boys who were interviewed were between 15 and 24. So in terms of their age. And really what came up was a high levels of vulnerability and insecurity when it came to issues of intimacy and sexual relations. And that vulnerability, though, was expressed only in terms of the interviews and with one another as friends, which also made us highlight friendship as a really important space amongst young Black youth to navigate conversations around sexual health, around love, around care, around issues which young men don't always feel comfortable speaking about in groups. And there's excerpts in the chapter where often a lot of the insecurities and issues that the boys speak about in terms of desiring to have particular types of interpersonal relationships, but not always feeling free to express that because they'll be laughed at by other boys, or they'll be made to feel less manly by other boys or emasculinated in different ways. But also strongly coming through in the interviews as well, that between the boys themselves when speaking as friends and in the relationships that they built with the two interviewers, they were willing to express those insecurities and how in interpersonal relationships challenges arise around issues of sexual health because of the types of performances of masculinities that are expected of them that aren't a correct reflection of their actual desires, which are desires to have healthy interpersonal relationships, both with one another and their partners, and not to engage in sexually risky behavior. So just some of the themes that came up from the interviews. The one is about centering vulnerability and care, which I've spoken about already. So how do we move towards creating the types of spaces that allow the vulnerability that exists in these friendships to be spread in greater numbers so that young men feel open to expressing not only insecurities and reservations that they have, but desires to build healthy types of relationships amongst one another. So, I mean, I want to read one of the excerpts quickly. I know I only have 5 minutes, but the interviewer asks, what is love? And Temba says, love is when you express your feelings to another person and show that you're willing to care. The interviewer says, okay, cool. So according to you, what is love? And he says, at this point, I don't know, but all I know is that love is a good feeling. It's a good feeling. And then he's asked, do you think Black boys can love properly? To which he says, yes, we are not different from other people out there. You give what you get. And the other boy says, I agree, we are not different from other boys, but just people think bad of Black boys. We can also love and capably. And I think this excerpt shows that young Black men are keenly aware of their need and desire for care and love. In most of the discussions, love was defined as the ability to express one's feeling to one another, with emotional expressions at the heart of what constituted love. So simply expressing feelings was not deemed sufficient, but there was also a strong emphasis on the willingness to care. So expressing those feelings to people who are open to listening, who don't have preconceived ideas of the boys and their behavior, but also can offer the type of emotional support and navigate the types of insecurities that arise with them as well. And so the last thing I want to speak about in terms of that is that not only is emotional vulnerability, safety of spaces, an important space, but we also think we also thought a lot about how removing pleasure from the discussion of sexual health is also not healthy. So that coming to young Black men with this idea that sexual health is about creating the most pleasurable experience for all those involved, open up discussions that move away from the type of patriarchal norms around dominance and violence to open conversations really about centering enjoyment, right? Putting a positive spin on it, that sex is not something dangerous and scary and that should be avoided at all costs, but it's all about having information, about having certain types of interpersonal ethics of relationality, and getting support for those. And so I think the last thing I quickly want to end on is this idea that it was really important for all of us to think about masculinities as constantly being in motion as the boys navigate obviously different spaces, different socio-cultural contexts, different economic contexts, spatial contexts, etc. There were different dominant narratives of masculinity that impacted their behavior at particular moments in time. So moving away from these rigid ideas of who they were, what they desired, and how they should be supported. This idea of masculinities and emotions really opens up a wider space of engagement where both their interior selves get to be centered and taken as important, but also the external influences that impact the development of that consciousness and those interior selves. So I'll end there. Thank you.
Thanks. I listen to you guys. It's like, as academics, we don't often have these celebratory, sort of launches, which I know UKZN has done such a sterling job in advertising us all. But just having listened to the two of you, a launch pad as well for young scholars like you and Malusi as well. It's just fascinating. I mean, in 2006, I know I wrote with Rob Patman around precisely the same issues about Black boys as bad boys, and how that narrative is enduring, and how your work is challenging that kind of discourse. So thanks very much. We're now moving over to the next theme of the book, which is social norms and masculinity and health. And we begin this thematic area with Ndumiso Ngidi, who was formerly here at UKZN, but is now associate professor at Fort Hare University in South Africa. And Ndumiso's research focuses on gender and children's geographies, examining the intersections of gender, sexuality, masculinity, and young people's spatial experiences. Over to you, Ndu.
Thank you. Thank you so much, Prof. And good afternoon, colleagues. Thank you for this opportunity to just briefly talk through my chapter. I authored a chapter titled Streetwise Masculinities, Poverty, Risk-Taking and Sexual Health in a South African Township. So the setup for my chapter is Nduzuma, which is a township north of Durban in KwaZulu-Natal, a township that is shaped by apartheid spatial planning and persistent post-apartheid inequalities. And so the focus was on young Black men and how they navigate poverty, gender norms, and sexual health in socially and economically fragmented township spaces. I was really curious at the onset of this research about the many young men that whenever I visit home in the township, I grew up around such a culture of young men who spend a lot of time throughout the day sitting in street corners around local economic areas such as tuck shops, taverns and shebeens. And so this work came out, was a product of that curiosity. And so I ask here in this chapter, how do poverty and place intersect with masculinity to shape young men's identities and sexual practices? And so in terms of framing around masculinity, poverty and risk, my work is anchored in the literature on hegemonic masculinity, but the chapter also introduces the concept of streetwise masculinities, which for me are locally forged performances of manhood, rooted in economic hardship, in social exclusion, and the symbolic power of sexual conquest. So unlike middle-class masculinities, one of the things that I argue is that the streetwise masculinities are not about formal success, but about survival, dominance, and recognition in street spaces. And so my work draws on 5 months of work, ethnographic fieldwork with 13 young men aged 18 to 24, mostly from impoverished sections of Nduzuma. I included in-depth interviews and participant observation with a deliberate focus on the most economically marginalized participants in the area. And so if I were to speak into the key findings, so one is a major finding that is framed around the streets as gendered social spaces. And so what emerges there is the word ukuchilexa, which a lot of the young men kept using chilexa to chill, basically, so that we chill. Chilexa on the streets, chilexa mgaqweni. And shebeens, which I discovered serves as a coping mechanism, as a form of a social support system and a site for masculine identity formation. So there was also then sexual health risks that are not, I argue, are not incidental, but central to performances of masculinity. Such things as scoring with girls, transactional sex, and alcohol use, all framed the findings from my study. So I just want to break down the chapter findings which were identified. So I identified 3 major findings. The one has to do with streetwise masculinities, where I find that young men derive social value through performance. So such things as sexual conquest, group solidarity, and public display of masculine dominance were key to how they construct and enact masculinity. And so the streets becomes the crucible where manhood is tested and validated, often through risky sexual encounters. And 2, the theme speaks to sexual health risk and symbolic capital. And so access to formal dating spaces in this particular township was constrained by poverty. And therefore relationships were often transactional, initiated spontaneously in public, and highly underpinned by alcohol use. And so sexual success it became a form of masculine capital, but often comes at the cost of health and consent. And then finally, informal economies and risk-taking. With very few legal job opportunities, some young men then resort to such things as petty crime, drug dealing, and pickpocketing, which are actions, while criminalized, are survival strategies that also bolster masculine status within peer circles. And of course, the use of alcohol and money came out as a form of securing sex, which further entrenches health vulnerabilities and gendered asymmetry. So these practices, I also argue in the chapter that they are not isolated behaviors, but are embedded within the wider ecology of systemic neglect, limited healthcare access, and unattainable hegemonic ideals of manhood. And so conceptually, my contribution, particularly with regards to streetwise masculinity, what I propose as streetwise masculinities in the chapter, helps us to understand how masculinity in this township and within amongst these young men is reconfigured in the post-apartheid township life. So unlike hegemonic masculinity, which often assumes access to work, access to education, stability, I frame streetwise masculinity as one which is formed in and through specific public township spaces. Two, it is tied to hustling and informal survival tactics. And it is validated through hypersexuality, through control, and of course, peer admiration. And these masculinities are not inherently toxic. They are adaptive responses to structural violence and economic exclusion. They represent a way of being in a world for young men who have been structurally positioned outside of normative paths to adulthood and of course manhood. And so just to close, the chapter basically highlights how sexual health can then not be separated from broader social injustices, and that masculinities, as I understand them in this township, is a practice of survival in the ruins of apartheid and post-apartheid failures. So thank you, Prof.
Fabulous. I guess you're never going to, I can't even tell you how proud I am of the work that you've done and how the book has given you an opportunity to develop that concept, streetwise masculinities, which we as editors, I have to say, were so struck by. And I hope that in the short overview of your chapter, it will be enough to entice not just the audience online here, but many others to read what is really such a powerful chapter. So thanks very much, Ndu. Our next speaker is Sophie Bagnay, and Sophie is an epidemiologist in the Department of Infectious Disease at Imperial College London, and her research interests are on infectious diseases, HIV particularly, and a focus on gender inequalities, masculinities, and other social determinants that shape engagement with health services. Over to you, Sophie.
Yes, thank you very much. I'll share my screen. I think I'm the only one who has the present. Can you see my screen?
Yes.
Okay, amazing. So hi everyone, I'm Sophie Bagnay, and I'm very excited to present our chapter titled Masculine Norms and Sexual Health Implications for Young Men in Zimbabwe. I'll zoom in a bit so it's a bit clearer. So masculine norms are socially constructed ideas of manhood that can shape health behaviors, often leading to engagement in sexual risk behaviors and avoidance of HIV services. So understanding how these norms function is very vital to improving sexual health of young men, especially since adolescence is a very crucial period for shaping behavioral patterns. So in this chapter, we use the quantitative approach to explore the contours of young masculinities and how they, in different ways, affect the sexual health of young men in Manicaland, Zimbabwe, and this is all in an HIV context. So this work builds on nearly 2 decades, not 2 years, of research on masculinities, including several qualitative studies by Moort and Skofdal from the Manicaland Center for Public Health Research. Over these years, data were collected on socio-demographic factors, sexual risk behaviors, HIV services, masculine social norms, and many others. So what we did was we updated a quantitative model which was originally developed by Reed et al. And validated this new model, which enables us to identify which aspects of masculinity contribute to young men's engagement in sexual risk behaviors and use of HIV services. So measuring masculine social norms in general population surveys could yield very valuable insights into their prevalence, but also in their changes over time, which is very instrumental when developing and also evaluating interventions for HIV control. So as I believe this audience is mainly qualitative, I will leave the quantitative methods for now. They can be found in our chapter. But first I want to show the four-dimensional model of masculine social norms. So 4 questionnaire questions measured each of these 4 dimensions. And for this chapter, these dimensions were then transformed into binary variables. So categorizing young men as either having more progressive or more conservative views on each of these norms. So the norms are toughness, anti-femininity, sex drive, and social status. So building on this model, we analyzed how each of these norms, how each of these 4 dimensions were associated with socio-demographic factors, with sexual risk behaviors, and HIV service use among young HIV-negative men aged 15 to 29 in Manicaland, Zimbabwe. So a few of the key findings were that conservative attitudes towards toughness, sex drive, and social status were found to be associated with several sexual risk behaviors in young men. A summary variable combining 5 high-risk behaviors was created to identify those engaging in one or more of these risky behaviors. We call these men as being part of the priority population who could really benefit from HIV prevention. The forest plot in the bottom of this infographic shows that high scores on each of these 3 dimensions were associated with engaging in one or more of these high-risk sexual behaviors. Interestingly, there seemed to be no association between holding conservative views on anti-femininity, as you can see here. Those men distancing themselves from feminine roles and being part of the priority population, which highlights the multidimensional nature of male gender norms. So when examining associations with use of HIV services among young men from the priority population, we found that conservative attitudes towards the toughness and anti-femininity dimensions were associated with lower odds of HIV testing. So this indicates that when young men hold more conservative beliefs about physical resilience, about their capacity to withstand illness, and the idea that men should avoid feminine roles and spaces within households, they are less likely to utilize HIV testing services. So the conclusion from this all is that despite the diverse and multidimensional nature of masculine social norms, our model has demonstrated its ability to capture this concept within a quantitative model. So implementing this skill into other multipurpose surveys could enhance the understanding of masculine norms and their varying strengths and effects. It could also prove to be valuable in different settings and in other health-related outcomes, but we haven't tested that yet. So it might be something for the future. Findings in this chapter mainly emphasize that masculine social norms are very multidimensional. Different dimensions appear to vary in effect and strength, and illustrating that masculinity is a very fluid concept influenced by both time and space. The young men may simultaneously, sorry, difficult word, hold more conservative views on certain norms and more progressive views on others. Approaches aimed at addressing the negative aspects of masculinity and gender norms need to be targeted and therefore context specific. And to end this, we would like to extend our gratitude to the editors, to Divya, Morten, and Kay Marlin, to Routledge, Sabrina for all her support, as well as all the authors, the funders, and of course, the study participants. A special thanks to Manicaland Center Fieldwork team and our local community guides for their invaluable support during all the processes. So thank you very much.
And thanks to you, Sophie, and your team And just listening to you, it sort of brings together. It's just wonderful listening to you, especially as you noted the quantitative elements in such work are not very far-fetched, are not very well researched, because I mean mainly qualitative work. So let's just see how this opens up new ways of doing research with men around what already has been one of our most common phrases here: masculinity in motion, masculinity as moving, and masculinity as fluid. Thank you so much, Sophie. Now over to our next, within the same theme, would be Landa Mabenge, who's at the School of Public Health at UCT, University of Cape Town, in social and behavioral sciences. And Landa's work focuses on inclusive primary health care for transgender, gender diverse populations in South Africa's public sector. Landa, over to you.
Thank you so much, Prof. Hi, everyone. Thank you for this opportunity and everyone who has been part of this. A big thank you to my co-author, Pierre Brouard, who is in the audience, I believe. So our chapter really titled Young Trans Men Gender in the South African Healthcare System. It's not rooted in field work. It's a chapter that we are writing about the trans population. And the reason why we didn't do field work is because the population itself is quite hidden, vulnerable because of the cis-heteronormative way in that healthcare is curated and packaged and delivered in South Africa and in many sort of social settings. So we then wanted to look at what currently is out there. And we wanted to then really open up a conversation by looking at existing literature, looking at literature on masculinities, on trans masculinities, on trans healthcare, and also just think about how trans young people would then negotiate their way into access to gender-affirming healthcare, which in essence is part of their sexual health, but also any other type of health care that they may need in the public health sector or in the South African health sector. So what we then did is we approached the chapter using an autoethnographic lens. We positioned ourselves as a Black trans man and a white gay man. And we sort of we started the conversation by sharing our respective experiences of the healthcare system, and also how, because neither of us embody hegemonic forms of masculinity. So we felt it was important to segue using that, but also to speak to our lived experiences and our embodied knowledges. And how we have been able to navigate the healthcare system, but also how we have had to be careful and what strategies we've used in trying to show the multiple layers and barriers and both systemic, structural, and even institutional barriers that could be faced by young trans men in the country. So our chapter really then went into thinking about trans identity development. What happens? It became very important for us to actually clarify the concepts of sex, gender, and gender identity, because in healthcare, those are still very much conflated. And that is a part of the reason why we argue that becomes the first barrier in many trans people trying to access care, because of a lack of understanding from providers of those care in the healthcare spaces, that they don't understand these concepts and what they mean in terms of the young people who may present themselves in trying to get access to care. We then looked at theories on masculinities, we looked at the literature, we looked at the various forms that sort of exist in literature, and then we segued into trans masculinities and what young trans people actually find when they are trying to curate their forms of masculinity and needing access to inclusive, enabling spaces for them to be able to do that, particularly when they need access to gender-affirming healthcare. And I mean, since one of the things that we've spoken about and we found in literature is the fact that, number one, there's a lacuna in the literature. There's not enough written about trans men. And secondly, there are clear sort of narratives of experiences of violence, discrimination, and exclusion from healthcare because of the type of system that packages and delivers care, and because healthcare practitioners are not capacitated. And also, they are unaware of how to work with trans patients themselves. And then part of this then was to also then try and think about what currently exists and try and make recommendations in terms of where we currently find ourselves. And part of that speaks to what is happening currently globally in terms of the rise in anti-trans sort of movements and sentiment. And I mean, since this chapter came out, there's been an accelerated rise, making it that much more difficult for young trans people to access care because of executive orders that have now sort of cut off the care, making it that much more difficult for people to get into healthcare spaces. And also thinking about masculinities then in that context and access to sexual health, it almost places everything in crisis, right? Because young men are left out, and young trans men are really not finding themselves embedded in these healthcare spaces. There's also this idea that there should be a reimagining of a values-laden sort of specific type of masculinity, which then again begs the question of whether or not we are not replacing one hegemonic form of masculinity with another, and what that will mean for young people who are trans, who are actually wanting to enter into enabling healthcare spaces and co-create health outcomes with those people who hold power in those spaces. So yeah, so we actually then find ourselves questioning also the restrictive forms of masculinity that are now getting airplay again, right? The ones that promote aggression, control power, and emotional repression, and what that would mean to a young trans person who is a trans man who was assigned female at birth and who is trying to find ways to get into authentic living and needing access to healthcare interventions in the process. So I think in all, what the chapter has done is to make a clear case where we take our embodied knowledges and we put those in there, not speaking on behalf of young trans men, obviously, but combing the literature and actually realizing that what the literature is saying is that young trans men actually are very much vulnerable, and they're very much closed off to what they would need. They face a lot of harm because healthcare practitioners and the healthcare system is not equipped to actually take them through and work with them in terms of what they would need out of those spaces. So the chapter really then I think it begs us to really think about how healthcare is curated, number one, how healthcare is delivered, but most importantly, how healthcare practitioners are capacitated and trained in how they approach working with diverse patients, including young trans men, who are not necessarily going to have a traditional hegemonic way of doing masculinity, because it's not a fixed universal identity, right? It's part of their becoming, it's part of how they are evolving, and it's a very important part of how they situate themselves, not only in society, but also in the healthcare system. So I think the chapter then makes a call that it's very important that in healthcare, there needs to be due consideration in terms of how trans men in particular are welcomed into healthcare, how the space can then be made enabling for them to co-create conducive health outcomes so that they are more visible and can be seen, and they can take charge of and ownership of their own healthcare. So I think, yeah, I'll leave it at that. But yeah, that was our chapter. Thank you so much.
What a powerful, powerful statement, Landa, especially in the global context of backlash and the idea that they're just two genders. And I absolutely commend you and Pierre. It's your work again is simply groundbreaking and opening up just conversations about how to move forward. And just, I mean, I don't want to delay the program any further, but I have to say this, how, as much as we're talking about, you know, enduring patterns of inequalities and violence and, you know, the hegemonic heterosexual norms, what is so fascinating about being in South Africa at this point is our ability to focus on issues which other sectors or other places in the globe might find redundant. So thank you very much for advancing sexual and gender justice more broadly. Our next speaker is Rosalind Kanyemba, and Rosalind is speaking on the theme around masculinity and sexual risk. And Rosalind is currently a postdoc fellow at the University of Pretoria in the Centre of Advancement of Scholarship. And Rosalind has written other pieces of work around masculinities, HIV, sexual and reproductive health, the care of children with disabilities, and using a masculine focus, but also a decolonial approach. Over to you, Rosalind.
Thank you, Prof. Bana. Thank you, everyone who is here. Let me first extend my congratulations to the editors and all the co-authors for this wonderful work. Our chapter is on chapter 12 with my co-authors K. Malin Govender and Guy Harling, and is titled Peer Pressure and Heterosexual Norms Among Young Black Men in Sonkele, South Africa. So basically, this chapter explored the impact of peer pressure and masculinity norms on the sexual behaviors of young men aged 18 to 24 in Sonkele. And this was done through interviews with 20 participants in their friendship networks. And the authors investigated how societal expectations around masculinity, especially hegemonic masculinity, influence young men's sexual conduct and the pressure they encounter to conform to these ideals. A summary of our findings, we confirm that masculine ideals and influences can lead young men towards certain behaviors that not only shape their identity, but also affect their health and well-being. For example, in many cultures, traditional views of masculinity highlight traits such as toughness, dominance, and emotional stoicism. And these ideals can cause young men to engage in aggressive or high-risk behaviors to conform to peer expectations and so as to validate their manhood. Again, among these behaviors, the pursuit of multiple sexual partners and engagement in unprotected sex was evident in our study, which is particularly worrying as they significantly increase the risk of contracting HIV and other sexually transmitted infections. The social pressure to demonstrate sexual prowess or fear of being seen as less masculine can both promote these actions and foster an environment where discussing safe-sex practices is stigmatized or dismissed. And this creates a substantial gap in sexual health awareness and education among young men, putting them at greater risk for HIV. Furthermore, the influence of misogynistic attitudes must not be ignored. These attitudes not only sustain harmful stereotypes about women's roles and independence, but also promote risky behaviors among young men. And as evident in this study, objectifying women and viewing sexual encounters as a conquest. These norms fostered a culture that undermines mutual respect and consent, further complicating the nature of sexual relationships. Overall, the study suggests that to effectively address these challenges, it is essential to understand how these masculine norms influence behaviors and perceptions related to sexuality. Tailoring HIV prevention strategies that align with young men's experiences and beliefs can make interventions more effective. And this may involve fostering open discussions about masculinity, promoting positive role models, and emphasizing the importance of emotional intelligence and also respect in relationships. And by challenging traditional ideas of masculinity and addressing the associated risk behaviors, we can work towards creating a safer and healthier environment for young men and their partners. I'll end here. Thank you. Back to you, Prof. Bana.
Thanks so much, Rosalind. And again, masculinity and sexual risk, we cannot discount or cannot not emphasize the continuing and enduring patterns of sexual risk associated with masculinities. I noted earlier on in the chat, somebody asked the question about what is masculinity and what is sexuality. Indeed, I hope that your conversation and opening up of your chapter has illustrated that, complex connection. We move now to our last thematic area, which is masculinity and HIV. And our first speaker is Sitsi Masvavure. And as I look through and even as I reflect back on all the speakers, I remind myself of the connections that I have with almost or so many of you here, including Sitsi. Sitsi is an assistant professor of anthropology and global health at the Worcester Polytechnic Institute in the US, where she co-directs the MSc in global health and the minor in global public health. And her research focuses on gender, sex, HIV, reproductive health, and menstrual well-being in Southern Africa and the US. And I have to say this many years ago, and I am very fond of the journal Culture, Health, Sexuality. And I know in 2010, if I'm not right or wrong here, Sitsi won one of the best paper awards for her work on young people in Zimbabwe and sexuality. So over to you, Sitsi.
Thank you so much, Divya. I can't activate my video. I think the host has disabled. So if you can turn that on, that'd be great. If not, that's fine. I'll just proceed.
If I just can ask Rakshika to please activate. Right.
Thank you so much. Thank you. It's a pleasure to be part of this book launch and excited to share this chapter. So I co-authored this chapter with Frederick Smith. I don't know if Frederick is in the audience, but he's he's Swiss, he's based in Switzerland, and took one of my graduate courses in health promotion several years ago, and is an amazing academic. And so we worked together on the scoping review. The title of the chapter is HIV Game Changers as a question, and we're interested in looking at whether PrEP, pre-exposure prophylaxis, and ART, antiretroviral therapies, are they changing how sexuality, HIV risk, and sexual health more broadly is being practiced by adolescent boys and young men? When Divya reached out looking for somebody to do a paper on ART and PrEP and young men and adolescent boys, we're excited to take on the challenge, and it turned out to be a big challenge. Not much, surprisingly, written on this topic. And so we did a scoping review, and a scoping review is really sort of mapping out the field to see what has been published on a particular topic, so you can sort of provide a map to show what is known on a topic and where the gaps exist. And early on, worked with a librarian at my institution and just came across a lot of roadblocks. So once you look at adolescent boys and young men and sexual health and PrEP and ART, the literature becomes so much smaller. Never mind masculinities. When you add masculinities to the keyword search, very little comes up. And I think part of it is, imagine, a Venn diagram where you have one circle is young men, one circle is adolescent boys, the other circle is sexual health, the other circle is PrEP, the other circle is ART, right? It's very complicated. So what we did is we did a traditional systematic review using those keyword searches, came up initially with over 600 articles. And then once we confined it to like Southern Africa and our inclusion criteria, we're down to 9 articles that met the the inclusion criteria. And then after reading the articles, they were important articles, no doubt, but we felt we couldn't write a chapter. We didn't have enough data besides saying, okay, this is what these 9 articles are saying, and here are the gaps, and then the whole paper is about gaps, right? And we thought we didn't think that would be a meaningful contribution. And so we're like, okay, we need to actually know, like, we need data on what is the HIV risk for adolescent boys and young men. What are the PrEP numbers? Young men, adolescent boys using PrEP. What do they know about PrEP? So we actually needed content before we could do an analysis. So then we looked at the demographic and health surveys, and to all the scholars in the room, particularly young, emerging scholars, make use of the demographic and health surveys. My academic background is anthropology, but I also do have training in public health. So I think sometimes, depending on your academic background, you might not use sources like the demographic and health surveys. They're all quantitative data, but it's all basic descriptive frequency analysis, no logistic regression, nothing crazy. So I encourage you to make use of those. So we looked at the DHS data from the 10 Southern African countries and their grade for capturing, HIV risk, condom use, transactional sex, all the HIV risk behaviors that we're familiar with. But they don't tell you anything about living with HIV. And we're also interested in the experiences of young men, adolescent boys living with HIV and what that experience was like. And so we resorted to using the FEAR, which is an amazing, amazing resource. Again, quantitative, but all frequency analysis, descriptive data. The FEARs are the population-based HIV impact assessments run out of Columbia, or were run out of Columbia University in the US, and ICAP in particular. And so what they capture are art use. So think of the HIV continuum of care, right? So enrollment into care, and then your care experiences, linkage to care, viral load suppression. They also include data on awareness of PrEP, willingness to use PrEP, and things like that. So that became a really good resource. And so we have a table in the chapter that summarizes or presents the quantitative data along multiple variables across 10 Southern African countries. Please look at it. I think that's our most important contribution to the handbook, that we actually present the data. So you can look at, what is the willingness to use PrEP level among 15 to 19-year-old boys versus 20 to 24-year-old boys, young men. Compare that to 15 to 19-year-old women or girls and things like that. And so I think one thing, as we do masculinity studies or any gender focused study, is who are you comparing to, right? And so this table does 2 levels of comparison. So within comparison, so young adolescent boys versus young men, what's happening among men themselves, and then also between young men, adolescent boys, and young women, adolescent girls. So when you do sort of like compare men to women, I'm using the binary because there's databases use the gender binary. So it's male, female, no data on trans identities or sexual minority identities, which is a huge invitation to scholars to start adding some quantitative data for those populations. So the big contribution is this quantitative data from FEAR and from DHS, and you can compare different countries, and you'll see a lot of missing data, which just shows that either that data was not reported in those databases, which again is a concern, what kinds of data we're collecting and not collecting. And then I'd like to move on to just some key questions that the chapter engages with, and which is relevant to all scholars and particularly young emerging scholars, is a study a masculinity study because it focuses on men? And that was a question. So even when we're doing the literature review, it's like, well, this study is all adolescent boys, young men, but the authors are not framing what they're doing explicitly using the lens of masculinities. Is that a masculinity study, or is a masculinities oriented study intentionally framing things as such and therefore analyzing these sexual health experiences from that particular lens. So that's big gap in the literature. Lots of other gaps in the literature that we reviewed, again, based on sort of the thinking behind a systematic review, right? You're relying on what's already been published, pretty much. We didn't look at books, so that's a limitation. We looked at some UNAIDS country reports, but we obviously, I'm sure there are lots of PhD theses and master's thesis and other grey literature that might be addressing these issues. But in sort of the ethos of a systematic or scoping review, these are the constraints. So we couldn't find anything on, or we found very little, maybe one study on substance use, adolescent boys, young men, and HIV. So that was surprising. No data reported in FEAR or DHS around mental health of young men, adolescent boys living with HIV. No data on stigma, right? Again, thinking of DHS and FEAR as their population level, right? And so they are generalizable to the broader population. So we're not collecting data on HIV-related stigma in these two databases. Limited data on sexual and gender minorities, non-gender binary populations, the data not stratified that way. And then we couldn't do a trend analysis, and it's something that we might consider doing, just comparing, a FEAR report from 2017, how do metrics change in 2019, in 2020, in 2024. So I think a trend analysis would help us really understand if PrEP and ART are truly a game changer as far as sexual health among adolescent boys and young men are concerned. So right now, to answer that question, are they game changers? Based on the literature and based on FEAR DHS data, we honestly do not know what kind of impact they're making, because we don't seem to have a comparison point to say PrEP use in 2020 was X, in 2025 it's now Y. We really don't have that data. So I think I'll stop here, and excited for all the chapters in the book. And Divya, just so you know, I received my copy of the handbook almost 10 days ago. So I got it earlier than you, which is surprising in the EU.
And I know it looks delicious. I have to say, Tsitsi, I'm so inspired, when you said, is this a game changer? How do we theorize masculinities? All of this is just opening up fresh new scope for work beyond the book. And, another key area, which I think is so essential here to note, is the way in which this book has brought together different disciplines, and it's interdisciplinary. Nature, whether it's an epidemiologist, an anthropologist like you, a social scientist like me, like Leslie, who's coming up right now. It's amazing how we can come together and address an area in ways that draw upon all our knowledge from different areas to build some sense of what we or some sense of how we can understand men and masculinities. So finally, our last speaker in the masculinity and risk section of the book is Leslie Gittings. And Leslie is at Western University in Canada. Her work focuses on health equity, gender, HIV, sexual and reproductive health. And Leslie uses a wide variety of methods, including arts-based and land-based approaches to address the well-being of adolescents and young people. Over to you, Leslie.
Thank you, Prof. And I have my copy of the book right here. I got it just over 2 weeks ago. So Tsitsi, I think we probably got them at the same time. And I must say, I couldn't put it down. It's such an honor and a privilege to be part of it. And just really hearty congratulations to the editors, the co-authors, and the team that coordinated the book. So today what I'm going to be doing is sharing some insights from my PhD fieldwork, which was in the Eastern Cape of South Africa with the University of Cape Town. And the research focused on young men men born with HIV before prevention of mother-to-child transmission, or ART, was made available to pregnant moms in South Africa. And what we did is we explored how adolescent boys and young men were navigating both traditional and biomedical health practices as they transitioned into adulthood. This work was part of the Mzansi-Wako study, which was a large mixed methods longitudinal cohort that was led by Lucy Kluver, Alona Tosca, and Rebecca Hodes. And the chapter I'm presenting today emerged from a collaborative reflection between myself and two young man researchers who I worked with, Sinabongo Mbula and Pakamani Kom. And we used a qualitative design with repeat interviews. And I'll share a case study to show some of the ethical and methodological complexities that we really hadn't anticipated. And you'll see that they relate to questions of stigma, consent in research, a request for support, as well as intersubjectivity between researchers and adolescent boys and young men. And this is something that I really reflect on and the power dynamics of it, as myself being a scholar situated in the global north, conducting research with adolescent boys and young men in Southern Africa. So I wanted to briefly introduce you to a young man who has to be referred to as Ta Sider. He, at the time of research, was 21 years old. He was living in a peri-urban area in Amatole district in the Eastern Cape. And he was really enthusiastic during our first life history narrative interview. He consented to a follow-up. And when we tried to reach him about a year later, his phone number no longer worked. And this was a really common issue that we faced in this really highly mobile population. So following our protocol, we went to his home. So our research team included myself, a white Canadian woman, and a young Xhosa male researcher. And we arrived in the research vehicle, which was a large pickup truck. It was designed for rural roads, and it was brightly spray painted for anti-hijacking visibility. And when we reached his home, he didn't come out. And after a couple of minutes, we left. We didn't want to draw more attention to him. A few days later, we used a different strategy. The same young Xhosa researcher, who is a co-author on this chapter, returned with a local Xhosa man driver in a more discreet car. And this time, they found Ta Sider at home. He was looking sharp. He was wearing a crisp white t-shirt, jeans, and a wooden cross. And he also had a visible rash on his face and arms. He agreed to be interviewed, but only outside of his community, and he recommended a restaurant in the closest town. So on the way, he opened up to the researcher and the driver. He said he didn't want to be seen near the spray-painted truck. He wasn't explicit about a link to HIV, but he said he was secretive about his status. So we thought that he had probably linked it, as well as us, to an HIV study, even though our materials didn't exclusively mention or explicitly mention HIV. And in that car ride on the way to the interview, he also opened up and spoke about two health issues that he asked for support with. The first was that he had stopped taking his HIV medicine 6 years earlier when he attended traditional initiation. And the second is that he had a health issue related to his circumcision that he wanted support with. So after the interview, we followed our research protocol. We contacted a hospital that said they could support him. And then when we reached out to try and connect him to care at the hospital, he didn't pick up the phone again. We visited his home in the same discreet car once more, and he didn't come out. And then we decided not to pursue further contact. And we weren't really sure if we were respecting his autonomy or abandoning our ethical responsibility to respond to his request for support. Months later, however, in reviewing clinic files, he had re-engaged in care. So really briefly, this case reflects 4 key ethical challenges in HIV and sexual reproductive health research with adolescent boys and young men. The first is around disengagement from care, which we know is potentially an issue that adolescent boys and young men might experience at higher rates. And specifically, his comfort in sharing with a young Xhosa researcher suggests that gendered norms might have shaped who he felt safe confiding in. And ultimately, we really should be thinking about intersubjective identities with the adolescent boys and young men that we are working with and planning how to support them when they do disclose barriers in accessing care. Briefly, the second point that I wanted to raise was about stigma. And despite our efforts to be discreet, our participant may have associated our vehicle with an HIV study, and this really raised questions about whether our presence inadvertently exposed him to HIV stigma, which we also know is a powerful barrier to care. he still chose to participate, and he engaged actively in the research encounter and requested support. So in sharing this case, something that I've really been reflecting on is how these relationships can carry harm, especially in stigmatized contexts, and at the same time may also bring about benefit. And then the third is really around what does consent look like within context of high mobility, because participants and many adolescent boys and young men might be highly mobile, changing phone numbers. And ultimately, it was really hard to know whether his non-response signaled the withdrawal of consent or rather his logistical barriers to participation. And this really, for me, has complicated how I understand and interpret consent and retention in research with highly mobile populations like adolescent boys and young men in Southern Africa. And then the last thing I wanted to highlight briefly was around requests for support and the importance of planning and resourcing referral requests for support. This qualitative study saw way more requests for support than the larger quantitative parent study, and we think that was due to the nature of trust built through repeat qualitative interactions. So really, to sum it all up, this case raised some difficult but I think important questions. Did we do enough? Did we do too much? Were we supporting or were we overstepping? And I don't think there are simple answers, but what this case makes clear is the value of reflexive practice, of continually questioning how our positionality, power, and presence shapes the research encounter. And it reminds us that ethical research is not just about protocols, but also relationships, context, and care. So in this, we're aiming to build on a very big literature that the editors have really trailblazed around research with young HIV-affected people that emphasize reflexivity, dialogue, and localized ethical understandings. And I think these are probably especially important when working with adolescent boys and young men who often face unique and under-acknowledged contexts. So I'll leave it there, but thank you for the chance to contribute and be part of this conversation.
Thanks so much, Leslie. That was absolutely fabulous, your chapter. And I guess I just want to hook onto some of the words that you've used: care, connection, you know, and of course, the whole question about how to do research. And what are our ethical stance in relation to doing such work. So your chapter 2 has sort of opened up, you know, the significance of questioning our role as researchers in the field and what might be ethical positions. So at this point, I know it's 15:43, I'd like to open up maybe for one or two questions before we bring the session to an end. And if there are any questions, please raise your hand or indicate that in the chat. So I'm going to assume that we don't have questions. We do have many comments. Thank you very much for those comments. And of course, given the time constraints, I am now going to bring the session to a close. But before I do so, maybe Morton, if your connection is safer now, maybe just a sentence or two about the book.
Thank you, Divya. And I hope you can hear me okay. A lot of noise in the background, but yeah, I just want to say a few quick thank yous. Thank you to you, Divya. I feel so privileged to work alongside you. Like, I've admired and followed your work for so many years. So being able to do this book with you has been wonderful. And I've learned so much in the process, especially both in experience editing, but also in all the authors whose work has profoundly deepened my understanding of masculinity. So I'm really just building the entire platform for these new ways of thinking around young masculinities to be presented here. Andy, thank you so much for your very generous reflections on the book. It's wonderful to hear your take on it. Your support of the book as a leader of the field just makes me so proud. And finally, thank you to all the centers for taking time to share with us your key takeaways of your chapters here today. And thank you, Divya, for hosting this session so expertly. It's been fantastic. Thank you.
Morton, it's been an absolute pleasure to be working both with you and with Kay. And I cannot even alert you to the significance of these kinds of connections. And I think about, just the last two speakers and the speakers before that, Roslyn, Leslie, Sitsi, Malusi, and Du, all of you, Landa, Pierre, I mean, all of you, there's so many connections that have been built up in the 27, almost 28 years of my academic career. And of course, when Andy agreed to be the discussant, I was so delighted, because I think when I started my research chair, I went to Andy and I said, Andy, this is what I'd like to do. And I hope you remember, Andy, I think it was 2015 or 2016. And Andy's work is so compelling in the field, together with Rachel Jukes. And of course, Andy mentioned, the shoulders upon which our work stood and stands upon. And what I see in terms of the contributions today is that 20 and more years ago, when we were writing about masculinities, who would have imagined that in 2025, we have another brilliant cohort of scholars, making moves in different directions. And if anything, I want to say a huge, huge thank you to all of you as authors of this book, without which this book would never have happened. Again, to my co-editors, you've been just fabulous and fantastic. To Sabrina and to Shanae, thank you so much for holding us together. To all to Routledge and to just the numerous people that have supported us and have been so kind. The one message to all of you, especially young scholars, is that this kind of connection that you establish is so vital in building the field. We may no longer be here in the future, but you will be growing the field and reminding us of the past and of the work that we've done in masculinities. To UKZN, thank you so much for advertising us across the world. We don't often want that kind of advertisement, but thank you so much. It really is so important, just listening and providing a podium and a pedestal for scholars to talk about their work. And to all of you that have attended, thank you so much. There were at one point 118 participants. We are super grateful to you. We know that the online platform is not always the safest. We did have issues today, but without this platform, we would not have achieved the kind of responses that we have today. I urge you to support this endeavor, to obtain the book and share the chapters and share knowledge of the book to all your colleagues, and so that this book can get the kind of attention that it deserves. Thank you so very much for your support.